Are you waking up at night with tingling of your hands? Do you get numbness, pins and needles while typing? Is driving for long hours also making the hand go numb? Or worse, is your grip getting weaker and starting to drop things? You could be having carpal tunnel syndrome, and we are here to help you understand and treat this disabling condition. Carpal tunnel is caused by pressure on the median nerve in the wrist. The nerve, as highlighted in yellow here, is surrounded by tendons to the fingers in a tight space. In this specimen, the median nerve in yellow is squashed by 9 other tendons within a confined tunnel formed by the ligament and the wrist bones. The tunnel is even tighter with bending the wrist, such as sleeping, typing, or driving. This constant pressure on the nerve causes tingling and numbness to the thumb, index, and middle finger. Conditions such as diabetes, pregnancy, and others listed here can all put even more pressure in the carpal tunnel, making your condition worse. Diagnosis of the condition is easy, and you can try this yourself at home. First, cup your hands together and look down at this muscle at the base of your thumb. This lady has wasting or shrinkage of the thumb muscle of her left hand. Now compare that with the normal hand on her right. You can tell the left hand with carpal tunnel syndrome has flattening of the thumb muscle. Next, we check the strength of the thumb. Because of the muscle weakness, the thumb was not able to reach upwards to reach my finger. The normal thumb on the right was not only able to reach, but also resist my finger pushing down. This wasting and weakness of the thumb muscle is an advanced sign of carpal tunnel syndrome that require urgent medical treatment. Next test is by tapping the median nerve at the carpal tunnel. 7 firm taps can often produce the typical symptoms of tingling and numbness in the fingers. Another useful test to try is by pressing the carpal tunnel and bending the wrist up. Simply hold this position for a minute to see if the same tingling and numbness will start to occur in the fingers. If these tests do not produce your symptoms, a nerve conduction study from the doctors can be useful to confirm the diagnosis. If you are diagnosed with carpal tunnel syndromes, we have a number of simple treatments that you can try yourself at home to relieve the pain. Medications such as anti-inflammatories are useful to relieve the discomfort, particularly before bed. You can also try a wrist splint to stop bending of the wrist, such as during sleep or typing. Certain finger exercises as shown here are useful to reduce swelling around the tendon in the carpal tunnel and reduce inflammation and stiffness. Try to focus more on finger movement with more repetitions and not to over-squeeze the grip. Combine this with the wrist movement exercise that can help to gently stretch the nerve. Again, focus on more repetitions of the small circular movement and do not overstretch if painful. If your symptoms persist, your doctor may recommend a cortisone injection into the carpal tunnel to reduce the acute inflammation around the nerve. This can be done in the doctor's office. The needle is directed away from the tightest portion of the tunnel to avoid nerve injury. This is a very effective treatment that will resolve your symptoms within a week. Most patients are able to resume normal activities on the same day. However, the effect may wear off and symptoms return after few months. A more permanent fix to the problem is through surgery. This is a straightforward procedure often done under local anesthesia and takes about 10 minutes. The ligament at the roof of the carpal tunnel is divided so to open up the tunnel completely without further pressure. Patients are discharged on the same day with dressing over the incision for 2 weeks. The stitches are then removed and patients are encouraged to continue with the hand exercises as mentioned before to prevent finger stiffness. I hope you find this video useful. Please leave comments below.